Type 2 Diabetes by Joseph Tamino and
Rachel Zucker. So for type 2 diabetes mellitus, we're going to discuss the pathophysiology, the prevalence, mortality rates, how obesity plays a huge risk factor, and its treatment options. So type 2 diabetes is a condition characterized by high blood glucose levels caused by either a lack of insulin or the body's inability to use insulin efficiently. With this disorder, the target cells become unresponsive to insulin due to a defect in its insulin receptor function. This is the primary physiology of type 2 diabetes and is referred to as a developed insulin resistance. As the patient's cells become more resistant to insulin, blood glucose levels rise and the pancreas responds by secreting even more insulin. As the disease progresses, the patient's condition will include both insufficient insulin levels and insulin resistance. Type 2 diabetes remains the most prevalent form of diabetes, representing 90 to 95% of people with diabetes. There is a higher prevalence of type 2 diabetes mellitus in middle-aged adults. In fact, type 2 diabetes has been referred to as age-onset diabetes. The prevalence in the senior population of ages 65 and older is also quite high, with 25% of the population living with this medical condition. In 2015, diabetes in general was the seventh leading cause of death in the United States. This is based on the 79,535 death certificates in which diabetes was listed as the underlying cause of death. In 2015, diabetes was mentioned as the leading cause of death in a total of 252,800 certificates. This data does not reflect the unreported cases of death related to diabetes. Research has determined that only 35 to 40% of people with diabetes who died had diabetes listed anywhere in the death certificate, and about 10 to 15% had it listed as the underlying cause of death. Because of this eye-opening mortality rates, we decided to educate on one of the leading causes of type 2 diabetes, obesity. Obesity plays a huge role in insulin resistance and should be a target for non-pharmacotherapy. Patients with type 2 diabetes should incorporate a medically supervised exercise plan and diet into their lifestyle. This can help reduce diabetes-related complications and in fact reverse insulin resistance. Treatment for type 2 diabetes is usually with non-insulin anti-diabetic drugs. There are 6 primary groups of anti-diabetic drugs. There are alpha glucosidase inhibitors, biguanides, incretin enhancers, meglitinides, sulfonylureas, and thiazolidine diones. Glycemic control is generally initiated as a monotherapy. If that fails, a second drug is added to the therapeutic regimen. Failure to achieve glycemic control with combination therapy indicates that the patient needs insulin to be added to their daily regimen.
alpha glucosidase inhibitors. This anti-diabetic drug class acts by blocking enzymes in the small intestines that are responsible for breaking down complex carbohydrates into monosaccharides. This therefore works to delay the digestion and absorption of glucose because carbohydrates need to be in a monosaccharide form in order to be utilized. This drug choice is usually well tolerated and has limited common adverse effects. This includes abdominal cramping, diarrhea, and flatulence. There has been reports of minimal liver impairment, so it is important to monitor drug administration.
The first medication is Precoce. It is an alpha glucosidase inhibitor and is to be used as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes. It works by lowering blood glucose by inhibiting the enzyme alpha glucosidase in the GI tract. It also delays and reduces glucose absorption. It is contraindicated in people with hypersensitivity to the drug, diabetic ketoacidosis, cirrhosis, inflammatory bowel disease, and intestinal diseases. A few adverse effects are usually GI symptoms such as severe stomach pains, constipation, diarrhea, and loss of appetite. A few nursing considerations to think about is to observe for signs of glycosemia, monitor serum glucose levels, and to instruct patients to take at the same time each day.
Biguanides. The only anti-diabetic drug in this class is metformin. The mechanism of action of this drug class is aimed at reducing fasting and postprandial glucose levels. This is achieved by decreasing the hepatic production of glucose and by reducing the insulin resistance. This drug does not promote insulin release from the pancreas. So, in other words, this drug does not depend on insulin to lower blood glucose levels, and therefore can be administered to patients that do not produce insulin on their own. Metformin also has the benefit of lowering triglycerides and LDL cholesterol levels.
One of the most commonly used medications for type 2 diabetes is metformin. It works by decreasing hepatic glucose production and decreases intestinal glucose absorption, as well as it increases sensitivity to insulin. It is contraindicated in people with hypersensitivity, metabolic acidosis, dehydration, sepsis, and hypoxemia. A few adverse effects are abdominal bloating, diarrhea, nausea, vomiting, and unpleasant metallic taste. A few nursing considerations is to observe for signs of hypoglycemia. So if a patient, and also if a patient becomes ill, assess for ketoacidosis or lactic acidosis.
Incretin enhancers. Incretins are hormones that are secreted by the mucosa of the small intestines. This is usually following a meal when the body's blood glucose levels are elevated. Incretins are responsible for signaling to the pancreas that an increase in insulin secretion is needed, and then the liver stops producing glucagon. There are two types of drugs that enhance the function of the incretin: GLP-1 agonists and dipeptidyl peptidase 4 DPP-4 inhibitors. GLP-1 agonists act by activating the GLP-1 receptor. Activating this receptor causes the same effect on the blood glucose levels as a natural incretin hormone. The disadvantage of this drug is that it needs to be administered subcutaneously up to twice a day. DPP-1 inhibitors, on the other hand, prevent the breakdown of incretins. This enhances the hormone levels, which in return produces a greater response.
Victoza is an incretin enhancer and a GLP-1 agonist. It is used as an adjunct treatment to diet and exercise for type 2 diabetes mellitus. It works by increasing intracellular cyclic AMP, leading to insulin release when glucose is elevated. It is contraindicated in people with hypersensitivity or patient with family histories of medullary thyroid carcinoma and diabetic ketoacidosis. A few adverse effects include headaches, rash, pancreatitis, diarrhea, nausea, vomiting, and constipation. For nursing considerations, you're going to want to observe the patient taking concurrent insulin for signs and symptoms of hypoglycemic reactions. These include sweating, hunger, weakness, dizziness, tremors, tachycardia, and anxiety. You're also going to want to monitor for pancreatitis, which would be indicative of persistent severe abdominal pain, sometimes radiating to the back with or without vomiting. And if pancreatitis is suspected, you're going to want to discontinue the use. Januvia is an incretin enhancer and a DPP-4 inhibitor. It is used as an adjunct to diet and exercise to improve glycemic control in patients with type 2 diabetes. It works by slowing the inactivation of incretin hormones, resulting in increased levels of active incretin hormones. This results in increased insulin release and a decrease in glucagon. It is contraindicated in patients with type 1 diabetes mellitus, diabetic ketoacidosis, and those who have hypersensitivity to the medication. A few adverse effects are headaches, pancreatitis, nausea, diarrhea, acute renal failure, myalgia, and back pain. A few nursing considerations is you're going to want to assess for rash, pancreatitis, and hypoglycemia.
Meglitinides. This class of drugs consists of two anti-diabetic drugs, both of which have a short mechanism of action, usually lasting approximately 2 to 4 hours. These drugs work by stimulating the release of insulin from the pancreatic islet cells. The action of meglitinides is very similar to the drug class of sulfonylureas. The most common adverse effects experienced by patients administered meglitinides is hypoglycemia.
Starlix is a meglitinide that is used to improve glycemic control and can also be used with metformin. It works by stimulating the release of insulin from the pancreatic beta cells by closing potassium channels, which results in the opening of calcium channels and beta cells. It is contraindicated in people with hypersensitivity, diabetic ketoacidosis, and type 1 diabetes. A few adverse effects include dizziness, bronchitis, coughing, diarrhea, and flu-like symptoms. A couple drug interactions are beta blockers that may mask the hypoglycemia. alcohol use, NSAIDs, and MAO inhibitors. It is important to observe for hypoglycemic reactions in patients who use this medication.
Sulfonylureas. Sulfonylureas is the first available hypoglycemic drug treatment of type 2 diabetes. This group of drugs is further divided into two classes, the first and second generation. Both of these drugs act on the pancreatic islet cells. They stimulate the release of insulin from the pancreatic islet cells and also increase the sensitivity of insulin receptors on target cells. The two subclasses have equal effect at lowering blood glucose levels, but the second generation is involved in less drug-to-drug interaction. The most common adverse effect is hypoglycemia. This is related to the over-administration or sometimes not eating enough with drug administration. Dextrose can be used to return the blood glucose level to a normal level if over-medicated.
Diabetes is a first-generation sulfonylurea, and it is used for patients to control blood sugar in type 2 diabetes when diet therapy fails. It works by lowering blood sugar by stimulating the release of insulin from the pancreas and increasing the sensitivity to insulin at receptor sites. It is contraindicated in people with hypersensitivity to the drug, type 1 diabetes, diabetic coma or ketoacidosis, and severe renal or hepatic disease. Few adverse effects include anorexia, dizziness, headaches, GI symptoms, photosensitivity, rash, hypoglycemia, and hyponatremia. A few drug interactions include alcohol use and its decreased effectiveness with diuretics, calcium channel blockers, and corticosteroids. With diabetes, you're going to want to monitor for hypoglycemia. Amaryl is a second-generation sulfonylurea and is used to control blood sugar when diet therapy fails. It works by lowering blood sugar by stimulating the release of insulin from the pancreas and increasing the sensitivity to insulin at receptor sites. It is contraindicated in people with type 1 diabetes, diabetic coma or ketoacidosis, and severe renal, hepatic, thyroid, and other endocrine diseases. It can cause dizziness, drowsiness, headache, weakness, GI symptoms, and photosensitivity. It has many drug interactions including diuretics, corticosteroids, phenothiazines, oral contraceptives, estrogen, and thyroid preparations, as well as phenytoin, nicotinic acid, and sympathomimetics. It is a nursing consideration would be to assess for hypoglycemia, as well as assess patient for allergy to sulfonamides.
Thiazolidinediones. This class of anti-diabetic drugs reduces blood glucose levels by decreasing the insulin resistance and inhibiting hepatic gluconeogenesis. The therapeutic effects of this drug takes about 3 to 4 months to reach its optimal blood glucose level. Both of the drugs in this class contain a black box warning for heart failure and an increased risk for myocardial ischemia. The most common adverse effects associated with this pharmacotherapy are fluid retention, headache, and weight gain.
Actose is a thiazolidinedione that is used for when diet and exercise does not work and can be used with metformin, sulfonylureas, or insulin. It works by improving sensitivity to insulin by acting as an agonist at receptor sites involved in insulin responsiveness and subsequent glucose production and utilization. It also requires insulin for activity. It is contraindicated in people with hypersensitivity, type 1 diabetes, diabetic ketoacidosis, and liver disease. Few adverse effects are edema, liver failure, and anemia. It is important to assess for signs and symptoms of heart failure, such as edema, dyspnea, rapid weight gain, unusual tiredness after initiation, and with dose increases. Thank you for listening. We're all